Hello, everyone. I'm Jim Garrison, and I want to welcome you to this 344th session of Humanity Rising on the 21st day of October. Fall is in the air in the Northern Hemisphere. Spring is in the air in the Southern. And I just want to welcome you to our ongoing reflections through Humanity Rising of what we're all dealing with as we traverse 18 months of the pandemic. We had a session a couple of days ago that I want to bring in because it was so fascinating and it ignited such a discussion, and the recording has gone viral because it pertains to health. And this is the final session today of health in Europe. And I want to bring in the point that was raised by a Dr. Todd Ovakadis, who graduated #1 in his class at the Medical School of Johns Hopkins University and also Georgetown Medical School. Has had a very distinguished career in energy medicine, has been developing a laser-based multidimensional platform that works with T cells around longevity, very sophisticated. And I asked him at one point during the program, as the program was coming to an end, how he understood, because he's a specialist in the psychosomatic basis of disease as his medical career has evolved. So I said, Todd, as you analyze as a doctor, specializing in psychosomatic medicine, which is the psycho-emotional, psychophysical basis for the formation of disease. How would you explain COVID? How do you explain how one virus went worldwide at the same time across cultures? What was the psychosomatic basis that made us all susceptible at the same time? And he thought for a while. He says, well, I think two things were operating at the psychosomatic basis of human beings that are still with us. Number one, we've lost our capacity for enemy and friend formation. We don't know quite who's in the in group and who's in the out group. And our categories of self-identity have been breaking down. False news is in the air. We don't know how to categorize ourselves anymore. And secondly, we don't know who wears the crown. We don't know who's in charge. We don't know how to determine commonly accepted morality anymore. Our democracies in countries where there's democracies are in consternation and are descending into divisiveness. So he says when an individual goes into that state of not knowing boundary formation and moral hierarchy and how do we calibrate our sense of normalcy, it affects our immune system. And he says it's very synchronistic that the coronavirus is in the shape of a crown, because that is a central challenge for humanity around identity and group formation. And that comment was really seminal to the discussion that followed. And I wanted to bring that in for this panel of health professionals. And because we're dealing in a situation in the world today, everyone, as we all know, where the question of health anywhere, whether it's in Europe or it's in Southeast Asia or it's in Latin America or North America, is all in a tumult as the world undergoes not only a pandemic that we haven't experienced for over 100 years, but a response to the pandemic that has been unprecedented in the history of the world. It's the first time in history or in the response to a public health threat, everybody was put in lockdown. That's never happened before. It's also never happened that we all en masse globally basically shut our economies down, closed our borders, and started to engage in social distancing and wear masks, which we're still doing. The United States, for example, is just now, and Europe are just now opening their borders. That's unprecedented. And it put all of us in a psycho-emotional, psychosomatic journey, now 18 months down the road, that has challenged us in never before. So what Todd Ovocata says, our immune system continues to be weakened by the response that we're articulating to the virus. And that's why it doesn't go away. We've lost our capacity to create the kind of boundaries, hierarchies, and sense of order by which human beings have navigated and established public health. So as we come into this last session, I just want to bring us into a very live discussion that's been occurring at Humanity Rising. And I know this program is about thinking out of the box. And there's something that everyone is prepared, but I just wanted to set the context for, most fundamentally, the importance of thinking and considering what public health is and needs to be as we go into a world and into the future of 2022 that is quite literally unprecedented in the history of our species, Homo sapiens. So it's going to be our capacity to actually think out of the box in a ways that not only honors scientific data, but also the human imaginal capacity to reimagine a future. That's the requirement on behalf of all of us as we contemplate how we continue to move forward, not only in a time of pandemic, but in a time of accelerating climate change. So I wanted to just bring those few thoughts in as we begin our program today. And then before we commence with our program, let us pause for just a minute. And in the midst of all this tumult, let us just center ourselves in our bodies. Let us take a deep breath, close our eyes, and if we can, just center ourselves, attune ourselves to our heartbeat. Feel your heartbeat in a spirit of gratitude and thanksgiving that you're alive. We're all alive at this most extraordinary moment in the human journey. Thank you, everyone. Now, with an open heart and a heart full of gratitude and love for each and every one of you that are joining our session today, I want to commence our program by introducing Lars Munter of the Nordic Health 2030 movement and David Somekh of the European Health Future Forum, who together have been convening, I think now 10 or more, maybe a dozen panels on public health very splendidly over the last year or so. So David, Lars, deeply grateful for everything that you've done. And I know we're now coming into your final session, and just want to acknowledge deep gratitude for your contribution to this very important dialogue on health in a time of COVID. So I turn the program over to you.
Thank you, Jim. Well, an old joke might be we have to stop meeting like this. But indeed, the background of why we're doing it is, of course, one of the reasons why we have to stop doing it, meeting like this, I hope. But that is, of course, bittersweet, because it's been a pleasure for David and I, especially, to work as a little bit like travel agents. We've been able to travel into nature, we've traveled into digital health, we've traveled into communities, we've traveled across the world. And in these last few sessions, we're even experiencing time travel. Last week, we traveled to the future to talk to, the future stakeholders and decision makers. This week, we're traveling to a slightly older group of teenagers that will help us in sharing their view and from their experience, how they see the opportunities when we think about outside the box on the future of health.
Yeah, and just to explain, we, in this last series of 5 webinars of the 15, we did a bit of an experiment by, instead of the conventional arrangement of presentations we did in the first 10, we wanted to get more of a fireside chat arrangement, to have more conversation and less kind of detail. But sometimes it worked, sometimes not so well. But we thought it would be very fitting in this last session to really bring old friends round the fireside with us. I think that it allows a more relaxed conversation, but also we really value their knowledge and expertise. So, Lars, would you like to present the first participant?
Yes, indeed. And speaking of time travel, those of you that were with us in our first session in the beginning of this year will have noticed a man standing in a forest. And with us today is indeed that man, Sean Conlon, working tirelessly himself and is literally with boots on the ground to try to change the future of health and in his community and vicinity. Sean, tell us a little bit more about who you are and what you see as the essential both challenges and potential for the future of health.
Great, thank you, Lars. I'll come back to the boots on the ground in a few minutes. I was reflecting on what I might say and how I might introduce myself as someone who, to a certain extent, has been involved in trying to think outside the box for quite some time. So I thought of my life so far as like a river. It started off as one single river, and then it seemed to have broken up into 3 different streams or sub-rivers, and over the last few years has come back again. So I know you had some young people last year, but looking back over my life, I can see very significant parts of it. So I just want to go through it fairly quickly. I don't know why I became an engineer. my wife still tells me I am still an engineer. It's a long time since I really considered myself an engineer, but I did get in there. And I think what attracted me to it was this notion of solving problems. So in those days, and it goes back to the late 1960s, would you believe, I was very much involved in industry, and I worked for a while in Africa, and then in Ireland for a German company, then in France, and then in Belgium. And then I came back to Ireland, and I'll come back to that, coming back to Ireland in a few seconds. But during all of that time, I was moving from engineering into what in those days was called quality management. And my river took me from, if you like, the more traditional quality management, particularly in the late 1980s, where we were looking at scientific methods. And I was greatly influenced by people like Deming, who talk about leadership being to blame and not the workers, and looking at statistics and improvement and control. And eventually into the 90s, I became much more interested in areas that Peter Senge and people like him were involved, experiential learning and systems thinking. And I suppose out of that, for me, came these notion, the word that came up was transformation. Even in those days. So in the early 90s, people were talking about using the tools of quality for transformation, and innovation and transformation were very much closely linked together. So I came back to Ireland, and that was, David and I would know the expression about killing the baby. Very often one has got to throw all the cards in the air, and we talk about killing the baby to move on to the next stage. So I through all of my continental experience and love of France and all of the, if you like, the cultural experience that was there, and I came back to Ireland as chief executive of the National Quality Organization, and subsequently became president of the European Quality Organization, which at the time was very much engaged in all of these, if you like, scientific tools and methods for improvement. But there was a subset of those people who were interested in what we called then transforming society. And that moved on right up to the early 2000s. And we had a core group of people there who were exploring other methods, so linking in with art and culture and using kinesthesia and endeavoring to explore how, if you like, these industrial approaches might be applied to society. And we call them summer camps. And it was through that movement that I met David Somekh, who at the time was looking at quality in healthcare. And I was very much involved in the foundation of EHFF. And if you like, this is where my river, which has been all one up to now, starts to split a little bit. So I continued on as chief executive of the National Quality Organization, and eventually it became too much for me. It became too busy. So I decided once more to kill the baby, and I moved from Dublin, a city life, very busy, very much involved in industry and so on, to Leitrim in the northwest of Ireland. Leitrim is the least populated county in Ireland. I think the total population, and this will probably amaze Americans, is 25,000 for the whole county. But it was here that I learned about nature, and I learned to embed myself in culture as well. But particularly in nature, as a city slicker and having been around all the countries, I became much more interested in, if you like, the whole of the ecology of what was around me here. And it's a beautiful place, very ordinary by Irish terms, wouldn't be considered as being a very hot tourist attraction, but it is nevertheless, it reminds me of a very gentle feminine beauty. So you need to discover it, you need to uncover it. And since then, I've become very much involved in forestry and permaculture and all of what is associated with what is necessary to transform our linkages with nature. And in particular, I'm involved at national level with an organization called Pro Silva, which is about the application of close to nature management of continuous cover forestry, which is a transformation, you got the word again, of how we look at trees and woodlands and forestry, and a mingling of the difference, if you like, the integration of an economic resource, but also linking in with nature and our place in nature and allowing biodiversity to foster and to grow, and at the same time to have a continuous life for the forest. But it was also here that I started to become much more involved in culture. I was always interested in languages. I don't know what my last count was, but it probably stacks up to 8 or 9 languages that I've dabbled in. But I'd be very proud of my Irish language ability. And I also like German and French in particular. But the Irish language, which is thousands of years old, is very much like where the world is at today, because we're allowing it almost, we're extinguishing it as a language because of the way English is dominant. So I became interested in this notion of the ecology of language and the ecology of culture, and maybe the way we can transform the way we can look at language and culture. So the third strand was a continuation of that work with EHFF and also FASTA, and you heard from Caroline earlier on in one of the sessions who was involved in that, Caroline White. FASTA is a systems thinking organization, and between EHFF and FASTA, I've become involved in looking at welfare and well-being and applying, if you like, some of this interest that I have in systems approaches to welfare and well-being. I've been involved in the development of the National Welfare Index, which is an alternative to GDP. It's an economic, a hard economic indicator, and we can talk about that later. But probably principally, I'm now involved with a number of organizations, including David, who was here, in the establishment of the Wellbeing Economy Hub, Alliance Hub in Ireland. And we had a great launch a few days ago. So this is where, for me, all of these strands come back together again. And I would see my earlier life in systems and scientific methods now really coming together as, if you like, a platform for being a catalyst for the development of a new way of living, a new healthy life, if you like, but using, if you like, the narrative around regenerative economy and well-being. So I'm open to all kinds of questions and discussion.
Thank you, Sean. I'm not sure if we do have David with us still. Thank you.
Yes,
yeah.
I decided to stay.
You decided to stay, yes. And a very interesting journey. Again, David and I, as travel agents, that was true. But in many ways, of course, that is the story of people that have worked with health for many years with passion and not necessarily with a given plan to begin with. The story of how these rivers or streams, that they split and may join themselves again later. We'll be talking to Sean some more later. Yes, indeed. And do ask questions in the chat as well. But for our next speaker to appear, I think a short intro. Shiran, are you with us? Then David will introduce you briefly.
Yes, indeed. Thanks, Lars. Yes, we hope very much to talk with Sean later when we all talk together. But Shiran, if you'd open your camera. So are you here? Where are you?
I should. Can you hear me? And
yes,
suddenly my camera.
It's playing up.
It worked before.
It did, yeah. Shiran, look, while you try and tame your camera, I'll just give you a brief introduction. Shiran
Yeah, do
Nayland,
that.
is the person who we look to for Danish health education. He's much more than that, but he is, if you, almost you could say, he's in some senses Lars's boss, but they work in a very flat hierarchy, and typically, as you might expect. And I've admired Sharon's activities over many years now, and he's been very supportive to what EHFF has been trying to do, and so on. Are you still struggling with that camera?
Yeah, somehow it doesn't. You still can't see me.
You still can't see you, but it is, of course, very fitting that you are the man behind the scenes, Sharon.
Yes, indeed. Yes, he is.
Yeah.
He's the,
Sometimes it's nice. Sometimes it's nice to be looked at also. Not according to my wife, but let's see. I'll change them.
David, maybe Sharon could leave and come back in again, and his camera would work.
Well, we'll just maybe though, if we stay in the Nordics, then David.
Yes, okay.
If that's okay with you, Bogey, if you have a camera that's working, we'll make sure that we can actually see Sharon in a short while.
Yes. We'll switch speakers. So Bogey, welcome. As you see from the background, Bogey represents here the Copenhagen Institute for Future Studies. But again, he's been a close colleague, for example, of, in fact, didn't we have you on a previous session, Bogey, I think, particularly with Professor Ilona Kickbush, and you do a lot of work together on leadership and so forth. And very much admire what you've been doing up in the far north of yours, where Lars is. And indeed, as you may know, Jim particularly made the point to us that from across the pond, while the Americans can admire that the European health system as being somewhat more connected than theirs, they particularly admire what's happening in the Nordic countries. So Bogey, tell us something about yourself.
Yes, thank you. Thank you very much. So just shortly, I'm the Director of Health at the Copenhagen Institute for Future Studies. I've also worked intensively, especially with Lars, but also on this Nordic Health 2030 that we initiated together. And our focus is very much on where is it we bring health. So it's the Institute for Future Studies. So by nature, that's what we are trying to focus on. And there are many aspects of this, and of course there are aspirations and very good stories to tell from the Nordics. There are some things that work very well, but there are also things where we know now that if we don't act, it will not continue like that. So a part of the Nordic that works, that we also highlighted very much in our Nordic process, is the culture and the values. On how to work together, and especially trust. And the trust makes it much easier to work with the data. And this is something that both Sharon and Lars also use a lot of time on in the Danish society, on that part. And for instance, as an example, when applying the tracing app in Denmark, that was then included into what everybody have, a app with the health records. And that goes through a secure, forced digital inbox that you need to have in a secure environment. So that's connected together. And these infrastructure actually makes it possible that you can work fast and have reliable infrastructure system to work with the population, which then again gives the trust when you want to convince people that vaccination actually is a good idea, for instance, with COVID. But what we are focusing on a lot now is that we have some Nordic learnings. There is a lot of data that we can use to work with, but in the end, this is about pushing quality of life and well-being during the lifespan, improving that for citizens, but also globally. And as we have seen now in the world, we as also was mentioned in the beginning, are things falling apart? One of our focus here is what is the new digital social contract? How do we work with that when that is not just geographical as it was before? We see many challenges for health, partly because we are still discussing as it is an analog world, which it isn't. We are discussing ethics, we are discussing privacy, we are discussing mechanics as it is an analog world. So how do we get to this new paradigm? And that is very much about leadership, as you alluded to. So we probably need a world which is much more systemic or much more system orientated. So based on system biology and system thinking. And that probably requires new kinds of leadership, where kind leadership probably is very needed. So we need to bridge very, how can I say, tough, hierarchical, reductionistic science with holistic application, which are big challenges. But then when it comes to health, which is our main target here, 80% of the health challenges are more or less the same around the world. So why should we work with that as something that's carved down into around 200 countries and even into regions in those countries? It doesn't make any sense. We have technology and concepts to do so much more than we are doing today. So how do we bring that? But we also have learnings from the past. 150 years ago, the average lifespan was 29 years globally. So probably 95% of those who are in on this session today would on average not be alive if that was the case still today. And the learnings are also that reaching almost 80 or above 80 in the best organized societies today, it's not just because of health, it's because of the surroundings. It's better life conditions, better schooling, it's nutrition, it's regulations on nutrition, it's refrigerators, it's a lot of those things that we get in. So what we have pushed very much in the Nordics, and also with the movement we're also pushing now, movement Health 2030, is how do we push access not just to healthcare but to health around the world? How do we do it globally? How do we scale? How do we learn in those ways? And that comes also back to the introductions. Where is our global compassion? So we see that with COVID now. The states failed. My conclusion is that we need to reinvent a dynamic, much more expansive kind of public-private partnerships to really push this forward, and that requires some really hard approaches to how we do it. But coming back to the Nordic and the work with Lars and Sharan, there we landed on that we by 2030 should have an aspiration on having health budgets using half of the budget on prevention and half on the care. So we come much earlier in. We should also have what we call the 2080. So we have 20% who really need care all the time in systems. And even in the best systems, the outcome of that care is not especially good today. So the chronic, especially with the ones with chronic disease. So how do we keep the healthy with a minimum effort so we can spend much more energy on those who really need help? And then coming back to this global part on the 1090, saying that everything that's developed for health today goes approach to the 10% richest in the world. How do we get everybody to also focus on the other 90%? That means companies, that means countries, that means the different organizations. How do we do that? Because health is the most important societal pillar, but it only works when we look at it as both nationally and globally on it. And here it also comes that the avoidable disease burden is very big. In chronic diseases, it's 80%. Premature deaths, it's on OECD countries is probably around 25%. So there's a lot of suffering and a lot of unnecessary spend of resources on things that we actually could prevent. So how do we get these focuses in again? And the new healthcare is not going to be inside what we today understand as the clinical system. It's going to be health in every policy and health in everything. And just coming back to, I think what I also mentioned last time, I don't think that climate change is the biggest challenge for health in our future. It's the lack of access to health and healthcare, which is the biggest challenge, so people don't have the bandwidth to actually work with climate change solutions. So thank you.
Thank you, Bogi, and thank you also for the quick stand-in when technical glitches also interrupts our travel agency. It's nice to have good people standing by. There's a lot of looking at what Sean told us before, how these streams merge and join together again. And we see, of course, over time that even structures of various kinds that we build to solve problems for us might be useful for a particular set of challenges and not very fit for other types of challenges. And we see before us, of course, especially now, both the challenges of health, the challenges of climate, which are different inherently from the challenges perhaps of security or a food supply that we had at one point. So we need a different set of institutions too. And we'll come back more to some of your good points, I'm sure, Bogi. But talking about experiences from working in institutions and with big challenges and innovation, it's my pleasure to invite our next speaker. Agnieszka, are you with us?
Yes.
Your camera, is that a favorable camera? I like those cameras. Thank you very much today. And Agnieszka is actually hasn't been with us before, neither via video or otherwise. And therefore, of course, it's really a great opportunity for us to hear about your journey and your experiences when working with health across a number of years. Especially in Europe, but with a global focus as well. So please enlighten us about your experiences and maybe also some of your, ideas or potentials for how the future can unfold in a positive way.
Thank you, Lars. Good morning, good afternoon. Thanks for the invitation, David. So my name is Agnieszka Dawal. I live in Brussels, in Belgium, lots of rain. And professionally speaking, I have a double background, evolutionary biology and public health. I spent most of my life in jobs and activities related to public health and healthcare in Europe. And I managed international projects. I worked in research, in consultancy, and in a hospital as well. I spent 7 years in the European Commission, DG Sante, dealing with all health policies. And since 2016, I have been with Philips, so health technology company. I always joke that I made a horizontal career in public health. And EHFF has been an extra adventure for the last 10 years or so. David involved me in it. So that's about me. And now coming to the topic, to the question of this webinar. So do we need to think outside of the box to transform health and healthcare? I would say probably yes. And why? Because actually thinking inside the box brought us where we are today. So we have, in a way, no choice. But when I was preparing for this meeting, I realized that actually, to this question, I have more questions than really answers to provide. So I thought I'll share some of them here. So first of all, transforming health and healthcare is a very debated topic nowadays in Brussels. There is no a day that people wouldn't talk about it. And myself, I witnessed several reforms of health systems, of healthcare delivery. In 1999, I had a chance to support one in Poland. And the big word and big hope was decentralization at the time. And we were very excited and very proud when the system was finally changed and up and running. Today, I was just in Poland a week ago. A new act is being prepared about centralization of hospitals. a swing. But it shows that healthcare, health systems, they are actually in constant transformation. And it's not only a question of one country, but we observe this in many, at least European countries. So constant transformation, but at the same time, a permanent need of transformation. So, and this transformation is often driven by politicians and is tailored for the duration of their political mandate. And the question I would ask here is if we need to transform whatsoever in health and healthcare, health system, so who should be involved in and who should be responsible for transformation? Should it be politicians? Should it be citizens, health professionals, designers, all of them? So maybe that's one question for all of you. And then next one is really what should be transformed. I wonder if healthcare delivery can be transformed in isolation as one sector. And probably some of previous speakers already alluded to this, that actually many weak points of healthcare delivery systems, they reflect the society as whole. So anonymous patients, unpersonalized care, over-engineered, inefficient bureaucratic systems, over-belief in technology, a lack of feeling of responsibility for other person. But those are not healthcare specific points, and yet they impact healthcare. So I wouldn't know where to start. Maybe we should think of this. And then my last point, so the COVID-19 pandemic gave a painful lesson about what is a real asset in healthcare. Healthcare professionals. In many hospitals, at least here, there were entire wards equipped to receive COVID patients, but with no staff. There were beds, there were ventilators, there were digital apps, there were digital solutions, but no staff. And it's not such out-of-the-box idea to have clinicians and nurses available for people at the moment patients or people need them. But I also would not know how to get them there on time. So that would be it from my side. Thank you.
Agnieszka, just to, I have to say, look, thank you so much for that reflection. I need to let people know, that you're more than just someone who got involved in EHFF. You are actually one of the, if you like, the godparents of EHFF, in that when you were a senior policy officer in the commission, you actually really supported us in making it happen. And it's wonderful for you to be now one of our directors since you've left the commission and so on, to continue to help us with your expertise and nurturing. But look, we're in this session, we're choosing not to particularly to question people immediately after they give their presentation, and we'll move on to Sharan shortly. But I just wondered, there does seem to, in terms of you asking those questions, I was interested in the way you answered them almost while you were giving them, which is really helpful. But what do you have a view? There's one of the criticisms, although we thought the younger people last week were very knowledgeable and very admirable, the thing is, they tended to talk about fixing the system. Now, I think it was clearly Bogie was giving an example of how he was thinking wider than that and recognizing, that there are things we must do so that we move out of the sick care economy, as it were, and so on. But do you have a vision of what health might be, if things work the right way, if we can extract the politicians' dead hand from the development of healthcare and so on, as to where we might end up?
Well, I have a vision. I think there are certain things that have to be kept. There is in Europe, at least, this universal coverage, access to health. I think this is what is a good key. It should be maintained. Then, yeah, I believe in a local delivery and local healthcare.
Mm-hmm.
You know, I would love to have personalized care, but not in the sense of genomic treatment, but just have a GP who knows me, who knows what diseases my parents suffer from, if I like gardening, if I smoke, and yeah, something much more local. I think that we would all gain on this one. And in a way, during the pandemic, this is what happened. People started to live local. They started to eat local, to shop local. Well, maybe if we sustained in a way this trend, that could be part of the solution, because also I think that people who act locally, you know, they are more also accountable for their acts, and they are more responsible for their neighbors. In contrast of what is happening now. And I'm not saying that we should come back to that before it was better, but I think in a smart way of technology, of different, for example, digital solutions, could help even to localize healthcare delivery.
That's very interesting. Look, thanks for that. Look, we need to move on then till we come together again for a discussion together. We've now got Sharan back on camera. Welcome, Sharan. That's technology for you. But I already half introduced you. I think it was actually a very helpful image for you, because I've always thought of you that way, as somehow the eminence grise. You know, sort of the man behind the scenes. But let's have the man behind the scenes tell us a bit more about himself.
Yeah, now my TV is saying, okay, yeah, it's working. Yeah, the man behind the scenes. Sorry for the blackout. I had to go into duty free. Now we're traveling. Well, my name is Sharan Nalanda, and I'm the CEO of the Danish Committee for Health Education, which is a sort of a government, non-government organization established 60 years ago, not by me, but by the government, but as an independent organization, an independent politically and commercially, which means that we own ourselves, we don't cooperate with the industry, and we don't do politics. What we do is that we're very focused actually on going from knowledge to action. What is possible? And now you had the young ones last time, and now you have some of us are dinosaurs within the systems. But I think if we well, I followed sort of the, sorry, I'm jumping a bit, but I was following the discussion sort of in the chat, and I think, if we think outside the box, does it matter if everybody we want to move is inside the box? Just a question. But I think we have sort of a unique in a post-corona or post-COVID society, and a post-COVID economic, we have a unique chance of maybe doing things a bit different than we're used to. I think we have a chance now to see sort of on a global perspective how sort of the different countries have done sort of the interaction with the COVID, and we have a unique chance of trying to do it differently when we talk about health. Traditionally, at least in Europe and at least in Denmark, I think it goes from everywhere. We act in silos. You have the health silo, you have the social silo, you have the defense silo. But I think we should take the opportunity in this COVID, in post-COVID economy, to think between the silos. That if I invest in one silo, what the output might be in another silo. And I think sort of I don't think it's thinking outside the box, but it's actually something that's possible that we can do now. I don't know whether I'm an economist as a background.
Well, from my side, I have the opportunity of seeing Sharan live from time to time. That's the power of my travel agency. But if we allow some of the other speakers to join us also, an interesting thing today is, of course, what's been said, perhaps also with the onset from Jim, not necessarily how we were psychologically prepared for the pandemic, but maybe that we are now psychologically prepared to do things in a different way. That we would not have been able to had we not have had this experience. And it's also fascinating that what we are seeing today is, of course, questions. A lot of questions. Last week we saw a lot of answers, maybe from the eager. Well, I think the right word is youth, but and in this today they're not so youth, but still experience and coming up with questions more than answers. The good old, the more I know, the less I know, maybe. Agnieszka and Sean with us too. Maybe, as you said, Sharan, what good does it do if we think outside the box, if everyone is still stuck inside the box? Yet, of course, if nobody innovates, as Agnieszka would focus on, how can we actually move ourselves? So there's a joint challenge of having to reinvent the airplane while we're actually in flight. Yet, I guess that since you're doing what you do, Sharan, Bogi, Agnieszka, Sean, that you're also very hopeful. You must be hopeful people.
Lars, so I'd like to come in. There's some interesting things in the chat about a healthcare system or a sick care system, and then I'd like to link it with. There's also a couple of comments about society being sick. And it's not just society that's sick, it's the planet is sick as well, perhaps. So a perspective is that, what makes the planet sick, what makes society sick, in the sense of, all the damage that's being done. And maybe the healthcare system is just picking up the bits from all of that. But I think there, a comment was made very early on about it's the lack of access to healthcare is the thing that's needed. But certainly when we go talking about well-being, we talk about narratives around the current systems, so, and in particular, particularly around the economy and the fact that the economy has a narrative going back probably only about 70 years. You could argue it goes back to the Industrial Revolution, but the narrative there is that you need an economy which is growing. You need an economy in which, it's competitive. If you're competitive, that means you're good. But by being competitive, it means there are winners and losers. And the winners and losers brings you back to this notion of access and equality and so on. So I'm very much one that likes to look at what are the underlying systems that leads to our narratives around the economy in particular, but also all the other systems. And there was a comment also in the box about moving back to our indigenous roots. And I know within FASTA, that's the Foundation for the Economics of Sustainability, there's a lot of support for concepts around commonage and the commons, and saying that we're all responsible for not just the environment, but for nature as well. And I think that leads you back into the values of indigenous peoples and how they took care of the commons, so to speak. So I rounding it off, I think sick society, a sick planet in the context of where healthcare should be going is perhaps where the questions are.
Yes, can I respond, Sean? Yes, someone's saying in the chat, perhaps it's not so much as a sick planet, but that it's a planet that's not been cared for. And I think you brought up that notion of care, didn't you, in relation to the commons? I think that's very apt. And of course, it reflects the fact that, again, the point Jim was making right at the beginning. Sorry, I'll get rid of it. It always happens, doesn't it? Hopefully someone's going to pick that up. There we go. Sorry about that. But really, we're a society that stopped caring for each other as well. And whether you attribute it to a virus attacking our immune system, or maybe something much more sinister about the fact that things are falling apart because we've stopped loving each other, because we've allowed ourselves to be led by people whose values are not the ones that we might share. And the problem is how to get out of this fix, isn't it? And I don't want to go all moralistic and so on, but because we're supposed to be talking about health, but really we've made the point, haven't we? Everyone has, that you can't take health in isolation. I wonder what other people think about this whole question of the position of moral values in the future of health.
I think maybe that at least Bogi has a point here, and of course it's easy to fall into the trap of I guess cynicism, also, David. But there's potential there, as Hans Rosling would tell us a lot often when he lived.
Yes,
Bogi.
and if I can start with Hans Rosling and his factfulness. So life conditions are improving. We've had probably a slight fallback during COVID, especially in the biggest areas. So we also need to take that in. But even, I mean, we have challenges, yes. But I would like to leave my old grumpy hat and take the youth positive hat. But I agree with what was said before on we are not ready to talk about solutions. We need to ask the questions. There is no doubt in my mind that what we need to change this is a paradigm shift. And a paradigm shift is many things. So what we do with the Skiana network is leadership, is developing leadership inside the health system, which is where kind leadership is one of the ways to go about. So we also see in most countries that we do not accept a leadership format which was okay just 5 or 10 years ago, where you go around screaming at people and forcing them to do stuff. That just is not acceptable anymore. So we are also moving in ways on what we accept and do not accept inside the organizations. So we are working with health systems and around health systems in more than 30 countries right now. One thing that has struck me and that I have not seen, at least not enough before, is probably the biggest challenge is the lack of real prioritization. So when you want everything, you get nothing. That is really what is happening. So and I do think that well-being economy is probably a part of this, but I'll come back to what I mentioned in the start. Our social contract was geographical until we all got the world in our pocket. We have not figured out what it means when it's both geographical and not geographical. We need to figure that out. We are not going back to an analog world. That world is over. So how do we do it? In Europe, we spend, I don't know how much money to try to get the digital world to fit into an analog privacy and ethics. It will never work. So we also need to be realistic and saying, if we want privacy, it's on the new terms, it's not on the old terms. This is what we call the S-curve challenge. So the old paradigm is outlived. So either it breaks down or we reinvent how we do things, which should be better. There is no in between there. So that is the challenge. And do we need to think economy differently? Yes. Do we need to think cross-border differently? Yes. We all come from rich countries. I will tell you, when I go to the poor parts of Eastern Europe, or to Brazil where I lived, or to Peru where my wife is from, they do not have the bandwidth to take these discussions that we have, because they don't have the life conditions and they don't have the access to help to it. So to ask for these things without helping all of them at the same time is an illusion. So that's where we also need to work.
That was part of a response to your question about morals, wasn't it, David?
No, I love the passion. Yeah, absolutely. It's very eloquent, Smokey.
Yeah. We have also a response from Sharon, I think.
Yeah, thank you. I agree with you, Bogi. And actually, that was sort of my point. If we think outside the box and everybody's inside the box, we doesn't move anything. We need to take our thoughts. Sort of, if we want to move something, if we want to change something, we need to do it sort of inside the box. I think it's difficult, as you say, it's difficult to compare. Now we're having a discussion across continents where we have sort of one mindset in Europe. There might be another mindset in some part of the US. So I'm not the one to argue what's best and what's not so good, because that has to be based on people living in the systems. But one thing I foresee, sort of also in the demographic changes that are coming for the next 10, 20, 30 years, as we have a sort of a Western world that becomes older. We have a sort of a down rate in childbirth, and we have sort of the amount of people getting older and becoming plus 65 is getting very huge. And we don't have sort of the economy to take care of, or sort of in hospital care, we don't have the amount of money to give the same service as we have today. And I think that goes for the insurance-based health system and the tax-based health system, actually. So we also need to take into consideration, I think, and that's my own thought, that's not sort of the organization I represent, but we need to talk about your own responsibility. I think that's sort of also very important, that if we can persuade people that the best way to get old is not being sick while you're old, and it doesn't make any sense to live long if you live long with a lot of diseases. The best part is to have a longer life without diseases. But it's not only the society that has that responsibility. You also have a responsibility yourself. And we have sort of a global world getting, for one example, fatter and fatter. And whose fault is that? Well, I think it's a joint fault. It might be the industry, it might be sort of people themselves.
It certainly becomes a joint challenge.
It will be, yeah.
Yeah.
This is, yes, I have to say, one of the things in response to that, Sharon, is we hadn't talked about education up till now as being again, this is another silo, isn't it? But in terms of where we start in the next 30 years is at least with the school kids, the primary school kids, even our grandchildren, in my case, that
we did talk about the importance of health literacy within that at one point during our travels, and maybe that's a response to that particular element, Sharon.
Yeah, actually, Bogi said it before. We need to go back to health in all policies that the WHO put on the agenda many years ago. But we need to look we can't look, as all of you have said, we can't look at health isolated anymore. We need to look everywhere where health is, within the educational system, with the environmental system, with the social system, with the defense, whatever.
Mm. Agnieszka, you've been listening patiently. Do you have any comment on what we've been talking about?
I was just trying to find out how to raise my hand, actually. Thanks for reading in my head. Many things. I agree with many things that were said here. It's true that there is some sort of. It should be some sort of shared responsibility indeed for health. But having worked with many countries while being in the European Commission, I know that this concept will be adopted easier in some geographies, and in some others it will be really taken as an attack on your liberty. So there is always this dilemma, and I don't envy politicians who have to put certain policies limiting maybe choice and increasing responsibility of people. This concept of health in all policies, I had to smile when I heard it, because that was one of my first things back in the Commission in 2008, and we had it in the health strategy that health had to be in all policies, and we are still not there. 15 years later, almost. We know that we should work on education. We know that we should work on agriculture. That all these things have impact on health, but it still doesn't work.
There's a message. A comment in the chat. A good old trope as well, I suppose, about parenting. Education, how to build a culture of health as well. And I do have an idea that is not your comment, Bogi, but maybe also, this is about patience, not patience, but patience too, because it does take a lot of time, and one might, with your case before, Agnieszka, become slightly frustrated about the pace of that change. I said before, or I asked you whether you were hopeful, and still, how does one keep that hope? Is a very important question too. Bogi, you had a comment maybe for that or something else?
Yeah, it was. Yeah, it can also be for that. So, I think my hope is quite clear here, because I think actually I do think that the health challenges and the environment challenges are very connected. These are both challenges nobody can solve alone. No country can do it alone. No company can do it alone. No municipality can do it alone. And it's something that you might do your little effort but still it has a huge impact on all of us if we all do that effort. So there are some things together in it. And coming back to linking to your question on the education, I think education is key. The key here is to unlock this and to get into the well-being mindset that Sean also was pushing forward. We have been pushing this, and Lars, we have discussed this at some points as well. So if we agree on that prevention is very valuable, and going back to Sharan, this is about diminishing the disease burden during the lifespan. So, I mean, it's not about getting people older just for the sake of getting them older. It's minimizing the disease burden they have in the lifespan. So how do we do that? Right now, it's increasing. So for every year you gain, you get half a year of disease burden on average. So that is clearly not good for anybody, and that's also strains the economy in it. So who does harvest the value of health who's not playing with? Who's free riding? How do we get them in? And I do think insurance company, pension funds, different kinds, and really pushing responsibility on companies as well. If we look around the world, do we really believe that all countries do have the capacity in 10 years to put in sustainable health systems that cover all their population in a reasonable way as we would see it? I don't think so. So these needs new players. The real, and I would echo Sharan in saying we are not to decide what is the right model, but we can define a minimal level playing field that does apply both for public and private players. So I think that's where the moral comes in many ways. And I think the challenge I see really here is that we need to differentiate between what is urgent and what is acute. I mean, COVID comes in and we get some acute needs. We have always the acute need for an extra hospital bed. So we go screaming for there. We will always miss the extra nurse, so we scream for that. But that doesn't resolve our structural systemic challenges on the health system. That is to get the disease burden down. So how do we work with urgency that is not acute and get that prioritized?
Too busy fighting fires to actually care about fire safety. True. Sharan, a comment along the same lines?
Yeah, I just sort of going to repeat what Bogi said. We need to invest in health promotion to diminish the burden of disease when we get older. But I think we also need to change the mindset, as Bogi said, in insurance companies. But the funny thing is, when we talk to insurance and pension companies in Denmark, I don't know whether it goes for the same in the other Nordic countries, they actually already got the point that the more they invest in health promotion and health prevention, they save money. So it's actually, there was a discussion in the chat that is the sort of the insurance companies that sort of have the health. That was at least how I read it, that sort of the American insurance companies, that health insurance companies, do they profit? Yeah, they might do, but I think that if they changed if they looked at the European or the North European companies, they would profit even more if they went into health promotion and health prevention, instead of just sort of raising the bill.
Sure. So you wanted to come in do you want to respond to that or something different?
Yeah, well, it's going back a shade. Education has been mentioned, and if you like, informed people and so on, and even well-being, I suppose. But my concern is that if you're doing all that within the current box of systems, then you're not going to do any good, you know. So I like to give just the example, because we talked, I think, a little bit about food moving around the planet during COVID, and I think COVID showed that up a little bit. But you know, Ireland, for example, it's only a tiny country, but we export 80% of the food produced in the country. And most of it, in a way, you could argue is doing damage, you know, because it goes off as essentially dairy and beef products, most of it going off as dried powder milk or other products to nursing mothers in China or places like that. It's a very profitable thing. It's great for the country and lots of people employed. But it also means that we're importing an awful lot of food. We don't produce food for ourselves anymore because it's perceived to be not economical. So the concept of what's economical is what's driving everything. And then you have things like chicken nuggets coming from China to Ireland, all the way from these factory housed chickens, thousands of them. Or you have apples coming to Ireland from South Africa. And we can grow tons of apples in Ireland, but it's cheaper to bring them from South Africa, you know. So these things, if you look at it from a healthy planet point of view, are totally nonsensical. They're absolutely crazy. And it's difficult to convey that nonsensicalness, if you like, to children or because in order to change that, you have to change the system and you have to change the fundamental systems, which are extraordinarily difficult to do. So that would be my concern. So when we talk about a sick planet and even a sick caring system almost, then we need to get back to what is driving it. And the long globalization, supply chain, and the competitiveness as it proceeds, I think, are fundamental drivers of all that.
That got a few hands raised. I think Sharan was the first off the bat.
I totally agree, but I think sort of the change has to come from both sides. We as users, as citizens, as patients, we have a responsibility to act, whether or not to have Chinese nuggets or South American apples. Because we can also make the changes from bottom up. And then the debate in the chat is now we have the food companies actually also need to take responsibility, and I totally agree. But thinking 3 or 4 years back, nobody would have thought that a little Swedish schoolgirl sitting in front of a town hall would make a change. But actually, suddenly she did. So we can and we must do it from both sides, bottom up and top down.
Bogi?
Yeah, I think that is the very important thing in it. But also I think there's another thing here. I think there are many imbalances or things that should be better in the system, as Sean is saying. But I think evolution is better than revolution when it comes to change, and I'm very frustrated with many things, as Sean also is. But I agree with Sharan also on that. So the bottom up, I hope this is more a hope than it's a realistic analyzed belief that we get back to some kind of a cooperative how can I say, movement in many ways, which can push some of these things forward, something that we saw 100, 150 years ago in many parts of the world. We have some of it still in the Nordics, not as much as we used to. But that is one way to bring that. But for I mean, going back to local food production is something that is needed. But it must also come from the demand, not just from the supply. I do really agree with Sharan on that part. But I will go back to what it's also about here. So the SDGs will gain more and more attention from decision makers the next 9 years, because they would need to say if they deliver on it or not. So there are some things to put there, and I will just say something I normally say when I have pure health talks, and play Yoda for a while. So technology we have, decision we need. So we can't just figure and go and think about we need more technology and we need more concepts. We also need to decide and work with what we have at the moment. And the world is not perfect and it will never be perfect, but it is our obligation to get the best out of it, but to have the weakest as the canary in the coal mine. That's what I think we are missing often. How do we get that in? That's the weakest in each society, but it is definitely also the weakest countries in the world. And we tend to forget that all the time.
Comment from you, Agnieszka, also.
Yeah, thank you, Lars. So you were asking how to keep the hope. And I thought I will try to see. I think that in a way, this crisis showed also that showed that the health systems as built now, they are not really responding to the needs. But at the same time, there are some encouraging signs in some settings where exactly this is, I think, what Bogi mentioned, that suddenly people started to work with what they had. And we observed in one country, for example, that at once within a few weeks, all hospitals became interoperable, and they could really share the patient data. Something that was not possible before because it was question of mistrust, because it was question of regulation that didn't help. It came, COVID-19 came, and suddenly that was possible. So yeah, let's not waste this vibe that was made by this crisis, and maybe let's just try to keep these changes that were possible.
Yeah, there's another good example, isn't there? The very rapid production of the vaccine in the UK was because they did exactly the same. They dropped the regulation, just got on with it, and when it was really needed. But of course, the trouble is that it then so quickly things go back to where they were. And there is an issue I want to raise. You know, we talk about, I think it's really appropriate to talk about personal responsibility, but we also have to remember, don't we, that people in society are influenced by leaders. And if you have leaders that are behaving irresponsibly or as we see, my country, unfortunately, is a very good example where the politicians are currently preaching that we should all take much more care, and yet for political reasons insisting not wearing masks when they go to Parliament, for example. What are the public supposed to make of that? It's very difficult, but I think that I know Lars would be keen to wrap up really at this point and take up the question of hope, perhaps. But I really am very grateful for this rich conversation. I suspect we might have a bit of a next conversation with Jim in a moment about the point he raised at the beginning. But thank you very much. And Lars, it's quite right that you should have a last word before we turn over to Jim.
Well, I do think that the others would respond to your comment too, David. But on the issue of hope, I know that several of people in this room have engaged themselves in building, initiating social movements over the last few years of various kinds, at an individual level or an organizational level, thinking of creating the bottom up, not waiting for the bottom up to appear. Is that how you utilize your hope? Is a question you might ponder too. Bogi, I think you were first, maybe.
Yeah, I do think that that's one way of doing it. I think we need to be very, very honest with ourselves that, as I also said, and several others also say, we don't have the solutions, but we need to ask the questions. So if we are trying to find the solutions before asking the questions, then we definitely are keeping the frames that were inside. So how do we get outside of that? And system thinking is definitely a way that needs to come in and practiced, to be practiced and do that. And I will just have a wish that I would like to give here. So we, going back to what David just mentioned, so fake news and infodemics is very much labeled as a huge challenge. I don't believe that's a new thing. I think it's always been there. But what has happened and got it worse is that, so when I started to attend really hard scientific conferences and meetings some 20 years ago, the craziness of ideas you could get out in order to find solutions was incredible. Now with everybody having a camera and a recorder in their pocket, nobody does that anymore. So the ones who really engage in trying to figure out new things are being very quiet as a voice for the betterment of society and societies. That is not good. So I will urge all of you who have capacities to step up, to come into the debate, even if it can be costly. And I think that is necessary for the change.
Sharan, a final comment.
I agree with Bogi. I think if we go back to the question that Jim also asked, not exactly, but what have we learned in a positive sense is that we can actually cooperate very fast between countries globally. And if we do that without sort of a pandemic sort of as a burning platform, but looking just as health as a positive platform, we might be able to move sort of globally in a positive health way. But I think, just to join the choir that Bogi says, is that one thing that we've learned in this pandemic and this this sort of debate is an example, is that we've learned to meet across countries, across continents, and talk. And we need to continue that. And then, as Bogi says, we need to raise our voices from where we are. But we've made it easier to meet across countries, only for an hour, only for 1.5 hours. But so even though sort of the countries have closed their borders, we've sort of opened the digital borders widely so we can talk. At least a lot of countries has. And we need to take hold of that and do that continuously.
Using the agency that we've got. Yes, indeed. I think that what's left for me of my agency in this travel agency is to say well, David might have a comment too, but a warm thank you to all of you for joining Lars and David Ayer in this journey around health. And I will encourage you all, of course, to use that agency where you can, when you can. Thank you very much for this debate. I look forward to continuing it in other places, geographically or digitally in the future.
Over to you, Jim.
Thank you, David. Thank you, Lars. And thank you, panel. This has been a splendid conversation. It's been very thoughtful. And I think, Sharan, you really kind of nailed it when you made your comment that the challenge is really when you get out of the box and you discover that most of the people are still in the box. You know, what do you do then? And this, of course, takes us all the way back to the allegory of the cave in Plato, when people kind of wake up and see the shadows on the walls, and then what do they do? And I think the discussion was very thoughtful around this point, and around your note of hope, Lars, that we need to use our agency in cross-border ways and new kinds of ways I think is a powerful impulse. It's not the answer, it's more of a means. But Bogi, I think you made a comment that I was very struck by as well, and that is that we don't have answers here. And we're really in a spirit of inquiry. And I think it's the spirit of inquiry with which all of you have engaged in these deep questions that have been very, very moving to me, because I think humanity is in one of those moments where certainty is elusive. And that's one reason why, as I was indicating at the beginning, we are more susceptible than we may have been otherwise to a global pandemic. I think the world as a whole is losing its moorings. We're losing the truths we so comfortably lived by. And that's shaken us. And so in some ways, people are very much in the box, but outside the box simultaneously. And the paradox of life is just as we were being shut down by COVID, Zoom opened us up because of COVID. And the way you all have played with those complexities has been very striking. So I just want to thank you. And Agnieszka, your notion of hope in this matter, I think was very, very meaningful as well. So I want to thank you. And David and Lars, I just, you've brought a dozen or more splendid programs to Humanity Rising in an extremely thoughtful way. And just to underscore the point about inquiry as opposed to certainty, the entire lineage of Ubiquity University and Humanity Rising is Socratic. And you remember Socrates said that it's, in the end, it's not the answers you provide, it's your capacity to ask deep questions and live in a disposition of truth pursued rather than truth possessed. And somehow I think in that complexity, agency emerges in a new way, and therefore the shape of hope as we jump out of the box and remember the box at the same time. So I want to really thank you all for that. Tomorrow, everyone, we're going to turn to the issue of polarity training, the polarity movement, which, as you know, has been around for many, many decades, and is a way of discerning the psychosomatic balances in the body and how the body self-regulates itself toward health. And that's something maybe to end with, is this notion that our bodies, even the human community, orients itself toward health in our basic intuition and the way the body always tries to deal with challenges. It's always seeking health and equilibrium. And that to me is a hopeful sign for us all and indicates that we're going to make it through this. We just have to communicate more deeply and broadly and reinvent what it means to be an agent of change in completely new situations. So thank you. Thank you so much. This has been splendid. Thank you, everyone. We'll see you again here tomorrow on Humanity Rising. And those of you who can join Stanley and others in the after chat session, please do. You'll see the link in the chat box. Bye for now. Really splendid, everyone.